Good morning, good afternoon, good evening, depending on when and where you're watching this video from. It's Dr. Kate, your radio, huh? There is something for us to learn today. That's why I'm here. In continuity of our lectures on infertility, today we'll be discussing endometriosis as a cause of female infertility. Endometriosis. Endometriosis is a pathology which involves the presence of tissues that look like that found in the womb of a woman, outside the womb. Listen carefully. What am I saying? Endometriosis is a pathology where the tissue that is supposed to be in the uterus, the internal layer, endometrial tissue, will not be seen outside the uterus. Okay? That thing that will produce menstruation during menstrual period, that is that will cause menstrual flow, or that will be weeping, that will come out as menstrual flow, that kind of cell, endometrial cells, endometrial tissue, they will not be finding it in places rather than the uterus. Okay, so the uterus, I told you, uterus has 3 layers. It has the layer that's the inside, the mucous layer, the mucous membrane, the mucosa, endometrium. Okay, and then you now talk about the muscular layer now. And then the outer one, which is the serosa. The uterus has 3 layers. So the innermost layer is the one that is the endometrial tissue, endometrial layer. That's endometriosis. We now find it's when you find this kind of tissue that is supposed to be inside the uterus, outside the uterus. So places where you commonly find such tissue, they will be in the pelvis, in the fallopian tube, in the ovaries, in the guts, GIT. How will I say now? The places that are made for food digestion. Like I told you, I promise you, I will use any word that you'll be trying to understand, okay? From the mat to the anus, there's a pipe that connects it. And they refer to it as the gastrointestinal tract. So it's the tract, or is the way where food we eat will go and be digested, and then go and become poo, physics, and will not pass it through our anus. So endometrial tissue that can be found, tissues that look like that one that is seen in the uterus, can be found in this GIT, in this place where food is supposed to be, can be found in the chest, can be found around the heart, okay, can be found in the lungs. And you know the problem. Anywhere these tissues are, when it's the time to menstruate, all of them will begin to menstruate too, because they look like that one that is menstruating, or that is bleeding, or that is weeping in the uterus. Okay? And so every time the woman is menstruating, the hormones, the estrogens that act on the endometrial tissue, the progesterone that act on the womb, the endometrial tissues in the womb, will go and act on these endometrial tissues, or endometrial-like tissue that look like that found the uterus. Wherever they are, the hormone will go and work on them, go and act on them. Whether they are in the pelvis, they are in the fallopian tube, the ovaries, in the lungs, near the heart, in the chest, wherever they are, the hormone will act on them. So that when the woman is also bleeding and menstruating, they will be bleeding wherever they will be in the body. So the bleeding now, the symptoms will not depend on where they are. Okay? The bleeding in the womb can go out through the vagina as menstruation. But these other ones in the other part, they will not come out. And because they don't come out, over time, they will cause additions, fibrosis. What it means is that, it must decay now to live there for the body to be able to absorb it. And the body is not able to absorb it. It will not cause healing of tissues together. Tissues can heal together. The intestine can heal to the bladder. The bladder too can heal to the pelvic wall. Fibrosis can heal all of these organs and tissues together. There can be fibrosis and additions in the lungs. Wherever this bleeding are, it will cause problem, cause severe inflammation. Okay? And that's what will not present as the symptoms that they have. So what are the symptoms with endometriosis? They can be heavy bleeding, menstrual bleeding in itself, because it can be in the womb too. And it's weeping seriously, heavy bleeding, intermenstrual bleeding, bleeding in between menstruation, prolonged bleeding. Okay? There can be anemia because of the bleeding. Wherever they are, symptoms, there will be cramp, severe abdominal pain, severe waist pain, severe back pain, pelvic pain because of that additions and cramps that are there. In the GIT, there can be constipation, there can be diarrhea, there can be blood. Some people can vomit blood during menstrual cycle. Okay? If it's in the lungs, inflammation, additions, fibrosis everywhere. The symptoms, it varies from mild to moderate. It can be mild, it can be moderate, it can be severe, depending on where these endometrial-like tissues are. Okay? And because the blood cannot go out, the blood will not cause problem wherever they are. It can be really serious. You know what I'm telling you? Books, researchers found out that the diagnosis used to take 6 to 7 years of the problems before they would not know, oh, it's endometriosis. They must have been thinking of several things because there are several things that will look like it. For example, pelvic inflammatory disease, irritable bowel syndrome, okay? All these other things that will look like it, they'll be thinking, what is this? What is causing it? Depending on where it is, they'll be looking at other things. They won't be sure. It used to take 6 to 7 years. So the advocacy is for you to know that when you begin to feel too painful menstruation, cramp that is interfering with life. Do you know some of the symptoms become fear, anxiety? When you want to menstruate, you are scared. And even the difference between that of fibroid and this one. Do you know the fibroid one might be worse during menstruation and maybe give you some relief until another menstruation will come, depending on the stage of the disease too. But this one, in fact, pain is worse after the menstruation. It's very bad during menstruation and worse after the menstruation. Why? Wherever it has bled, it didn't have a way to go out. So the inflammation will be worse, pain, cramps. Some people will feel bloating, abdomen will be tight and all that. Some people find it difficult to breathe, especially when they bleed into the chest and all that. You know, they actually will be in severe pain, feeling unwell, nausea and vomiting, malaise, body pain, not knowing what it is like. Some will not be anxious, fear, worries, infertility. I told you it can also be in fallopian tube. Fallopian tube can become blocked because of continuous inflammation, adhesions, and fibrosis. The pelvis can become frozen because of endometriosis. And some people can be having this suffering. They begin to wonder, why am I a woman? Why this suffering? And they wouldn't know. And doctors now should look towards this direction. You know, with advocacy and adequate education, the delay in diagnosis should be out of the way. Should not be a problem again. Should not be a problem these days. Our people should find help. You know, when we see a woman with this kind of pain, severe pain, this kind of symptoms, let's quickly think endometriosis so that we can rule it out and don't allow them to suffer for a long time. You can imagine researchers have seen that about 6 to 7 years before they can make diagnosis. Endometriosis is also not too rare. It's a common disease too. It is said that worldwide about 190 million women present with endometriosis. 190 million women. That's about 10% of the world population of women have endometriosis. While over 100,000 of Nigerian women have endometriosis. The problems with it, aside this excruciating pain and all that, problems with getting pregnant is also a problem. But one thing you must know that the books have it, the researcher found that about 60 to 70 women with endometriosis are still able to get pregnant naturally. Okay? And so if fertility is a problem, you need to start up your medication early. It doesn't have a cure. Okay? But the symptoms can be managed. Symptoms have been seen to be better post-menopausal. Okay? When this hormone is no longer there. But it has been seen to still be there for postmenopausal women that are using estrogen, okay, that are using hormonal supplement to augment or to relieve their symptoms, so they can still have endometriosis symptoms. So what you have to do if you've got endometriosis, in fact, if you've got chronic, let's start from people with heavy bleeding, severe pain. They have told you it's not fibroid because when they do scan, they won't see fibroid anywhere because this one had to affect the entire womb. You know, it has to be wherever it is bleeding, that's where it will be. Okay, so you will know, they must have told you it's not fibroid. You'll be wondering, why is menstruation painful? Why is it too long? Why is sex painful? Why is urination painful? Even when your bowel is moving, when your stomach, the gut is moving, some people feel pain. Depending on where it is. Your tummy is moving, you are feeling pain. Everywhere pain, pelvic pain. You are urinating, you are feeling pain. Sexual intercourse, painful. You know, that's what endometriosis can do. Difficulty in breathing for people who've got endometrial tissue in their lungs bleeding. I've seen a patient who presented in my institution. She had blood in her chest, hemothorax, because of endometriosis. Even at that time, the parents were beginning to wonder whether they could just remove the uterus because the problems were too much. So how do they go about diagnosing this? Your symptoms, they will take your symptoms. This bad pain that can interfere with your life. Loss of work hours. Do you know some people have been sacked in their places of work for the fact that they are always sick? Every time they are menstruating, they are sick. Even after menstruation, it will take them time to recuperate. Some have lost their job. Some can't even get a job going. Some have lost relationship, can't even get a relationship going. Because the man will say she's always sick and they'll find a way to run away. How can the menstruation be this bad? How can she be this sick after menstruation? They will run. They are not able to keep a steady relationship just because of endometriosis. This is for your information. Early diagnosis is also a good thing because you will have to start your medication early. It doesn't have a cure, but the medication is targeted as relieving your symptoms. Pregnancy is actually protective. For the period of pregnancy, the symptoms seem to be reduced. And when pregnancy comes and you don't have regular cycle again, the symptom will resume. So they use hormonal drugs. Anti-inflammatory drugs too can also help to downplay the inflammation because the inflammation actually worsens the pain and the prognosis and the way they will be very sick to interfere with their daily life. They are not able to do all that they have to do. That anxiety, fear, depression cannot even come in. Okay? But it is not the end of the road. Early diagnosis will help you. There are drugs to help you manage your symptoms. There are counseling and medical options to help you bear children. Okay, so don't die in silence. In fact, if you have such symptoms that are looking like what I've discussed, if you get to the hospital the next time, if your doctors are confused and they've not told you it's endometriosis, say, sir, please, when a doctor was discussing endometriosis, my symptoms actually look like that. Is there a way you can help me look at it in the test so that they will see whether it's endometriosis or not? Okay, because one of the problems is late diagnosis, not diagnosing it on time. The person must have suffered from severe symptoms before they will not say it's endometriosis. Okay, the symptoms can be managed so that you can have a beautiful life, so that you can be free from the troubles. Okay, so in the options, in making diagnosis, they can do ultrasound, they can do magnetic resonance imaging, that's MRI. They can do laparoscopy, where they will have to put a small hole in your belly, and they will not look at it from a television to see whether there are some tissues that will bleed there. They can even take biopsy and do histology to see whether the tissues resemble that of the uterus, and they will not make diagnosis and say it's endometriosis. So any woman out there, any young woman out there, married or single, that has got endometriosis, I feel your pain. Don't worry, it is not the end of the road. In fact, that's why I'm here, okay, to tell you that it is not of your fault. It's not your problem. You're not the one who caused it. Okay, seek help early so that your symptoms can be relieved and your life can be better. Okay, so that you can have your job back, you can have your relationship, you can have a steady home. Okay, present. There are drugs that can help you. It's not your fault. Don't be suicidal. Don't be depressed. Don't say why you. All that will cause worry. All that will increase stress, because why me? Why me cannot remove it? It's already there. Okay, handle it with a positive mind. You can have your children with endometriosis. There are surgical procedures too, depending on how severe your symptom is, where they will have to go and remove the endometriosis, endometrial tissue, wherever it is. Okay, so that it won't be bleeding in there. So whatever your doctor is advising you, take it. It's to help you relieve your symptom and live otherwise healthy life. That is why I come to you every day. Hope you've learned something today. Endometriosis as a cause of female infertility. When it is managed and adequately followed up, you can have your children. There's no cure, but the symptoms can be managed, and then post-menopausal, you will have better relief from the symptoms. In fact, it will not be as bad, even if it's not going to be completely out. As far as the hormones are off post-menopausal, you'll be free from the symptoms that plague you. Have a great day. Face it with a positive mind. You man, I need to talk to the man. A woman that is having endometriosis, she's going through a lot of pain, you know. She's going through a lot of pain already. Please don't add to her pain by looking at her as an alien. As in, what's wrong with this woman? Is it Ogbanje? Why is she always sick? Why is she not strong like other women? It's not her fault either. Please be compassionate. Be loving, be caring, be understanding, okay? There's a pain that is unbearable, that is torturing, that is warning. When something is worn out, straining, demanding, pain, excruciating pain, cramps that they feel because of the chronic progressive inflammation, continuous repeated inflammation for the deposit of menstrual blood, menstrual bleeds in places where they are concealed. It can get a cyst. It can form a cyst. Okay, it can block the tubes. It can form fibrous tissue within the ovary, responsible for infertility. It's not their fault. If that's enough trouble already, don't add to it as a husband, okay? Be understanding. There's a solution. There's a way out. And once you have completed your family side, there are other things you can do, okay? That will not support fertility. That's why you don't do it until you have your family cycle. It's like now assuming hormones that will help you assume the male status, so that there will be a hormone that will support the endometrial bleeding. So you will not be having menstruations that will now bleed in other sides, okay? So you just stay in there, complete your family size, and be good. Men, be understanding, be good husbands, okay? What if it's your sister? What will you do? Will you kill her? No, be understanding. Women, don't deceive anybody. Just pray and tell them the truth, okay? Because if you lie, the truth will break or destroy what you were trying to lie to protect. You were lying to protect a relationship. You were lying to protect a marriage. The truth will end up breaking those things. Hope you've learned something. Thank you for listening. After endometriosis, the next topic is a polycystic ovarian syndrome as a cause of female infertility. Stay tuned. Hang in there. There's always something to learn. I promise you, it will never be a dull moment here at It Is Better Preventing Disease. Have a nice day. Bye.